walk in, hand hygiene. We're gonna introduce ourselves, explain what we're going to do, which is an assessment. Two patient identifiers, make sure they don't have any allergies, anything like that. Get their vital signs, get consent to do the assessment. We're gonna ask how often they've urinated, if they've urinated at all, if they know how much they've urinated, and if they need to go before we get started, because we don't want a distended bladder when we go pushing around on her. For labs, we're looking at RH, H&H, and the rubella immunization throughout the whole pregnancy and birth process. Go ahead and put our gloves on. We have consent to proceed. We'll start at the breast. For the nipples, we're looking for any cracking, chafing, bleeding, bruising, any sore spots anywhere. We're going to look for engorgement in the breast. If they're non-lactating, they can use a cold compress for any discomfort, and you do not want to stimulate the breast. And they always want to wear a supportive bra at all times. Moving on. We're going to listen to all 4 quadrants for active bowel sounds. We're going to ask them if they've had a bowel movement or passed any gas. We want to make sure the bladder is not distended too much before we go pushing around. The symphysis pubis, and we'll put our left hand on that symphysis pubis. Then we'll find the top of the fundus, which should be right around the midline. We're looking for the height, position, and tone. If it's boggy, we want to massage that. And when we do, we're going to look for any gushing coming out. The bogginess is a sign of bleeding. We want it to be firm. We also want to make sure, assess for any kind of pain or discomfort while we're pushing around. Her pads, we want to instruct her to put it front to back when putting them on. We'll have a Perry bottle of warm water for her to clean. She wants to clean front to back. She wants to dab dry front to back. Everything needs to be front to back to keep everything as clean as possible for her. And any bleeding, we always want to look at odor, color, and the amount. We're going to roll her over. We're going to look for any pooling, any edema, redness, pain, anything abnormal back here, hemorrhoids, just anything that shouldn't be there. If they are, we want to inform them that if they are saturating a pad every 2 hours or less, that they need to let somebody know, because it's a sign that they're still bleeding or have started bleeding. And every 15 to 30 minutes is a good indicator of hemorrhage. Down to the legs, we want to have them relax their legs and then dorsiflex. And we are looking for any pain or discomfort down here in the calf, which signifies a potential DVT. Also looking for any edema, redness, pain, discomfort, anything abnormal with the skin color. And throughout this, especially during the abdominal exam and the perineal area, we'd have them in a supine position. Once we finish with our assessment, we're going to get them comfortable, and we're going to do an emotional assessment, make sure they don't have any postpartum depression. If they have any home needs, if they need a car seat, formula, anything like that, we can arrange for them to have it on discharge. And anything that we can't provide, we can refer to a social worker or somebody to help provide it. Once we're all done, hand hygiene, report, record, and evaluate.